My name is Edward Choke. I am a senior consultant vascular surgeon at Sengkang General Hospital in Singapore. And the title of the study is the XTOSI study, looking at magic touch sirolimus-coated balloon for the treatment of peripheral arterial disease. Peripheral arterial disease is a global burden. In Singapore, the problem is particularly big because of our huge numbers of diabetic patients, which means we have a large population of patients with critical limb ischemia. For peripheral arterial disease, the first line revascularization strategy is usually with angioplasty. However, with angioplasty, although we can achieve immediate technical success, early restenosis resulting in repeat revascularization is very common. Efforts to improve the durability of our angioplasty have led to major research endeavors in the last 2 decades, of which paclitaxel drug-coated devices have received the most attention. However, with paclitaxel devices, 2 problems have transpired. Firstly, for below-the-knee disease, outcomes with paclitaxel-coated balloons have been disappointing. And secondly, serious concerns have been raised over the safety of paclitaxel devices. From the meta-analysis published in 2008 on the long-term safety concerns for paclitaxel devices. Therefore, an alternative effective drug-coated balloon option is urgently needed. Sirolimus is a potent anti-proliferative agent. It is considered a cytostatic agent, and for coronary circulation, it is considered effective and a safe option. However, until recently, it's been very difficult to coat sirolimus onto a balloon platform. The emergence of nanotechnology has, however, enabled us to apply sirolimus to drug-coated balloons. So we've got this option of the Magic Touch PTA sirolimus-coated balloon, and we therefore wanted to investigate the safety and efficacy of this sirolimus-coated balloon on peripheral arterial disease in this study. The XTOSI is a first-in-man clinical trial looking at the clinical safety and use of the Magic Touch sirolimus-coated balloon in the treatment of peripheral arterial disease for both femoral popliteal lesions and also below the knee lesion. It is a prospective, pre-market, non-randomized, all-comers single-arm trial. We aim to recruit 50 patients. 55 patients were screened, and we managed to recruit 50 patients. Of these patients, there were high-risk patients. Majority of them were elderly with an average age of about 67. Up to 90% of them had diabetes. Up to a third of them had coronary artery disease, and 1/5 were already on dialysis. In terms of ASA scores, 80% of them had ASA scores of 3 or 4, which means they were highly unfit patients. There were also patients with the worst type of peripheral arterial disease. They had critical limb ischemia. Up to 94% of patients had Rutherford scores of 5 or 6, which means they all had wounds in the majority of patients. And of these patients with wounds, the majority of them, 51% of them, had Wi-Fi scores of 4 and above. The study's endpoints were 2 endpoints. The efficacy endpoint was defined as primary patency at 6 months, which was assessed by duplex peak systolic velocity ratio of less than or equals to 2.4. The other endpoint was a safety endpoint, which was a composite of freedom from 30-day mortality, freedom from 30-day amputation, and also freedom from 6 months target lesion revascularization. Yes, so we have reached our 6 months outcomes for for all the patients enrolled. In terms of the 6 months outcomes, the primary patency for the entire group was 80%. When we did subgroup analysis For the femoral popliteal group, we showed a 6 months primary patency of 88%. For below the knee, the 6 months primary patency was 74%. Now, if we compare this with historical literature, and of course, there are certain issues, we're not comparing exactly the same type of patients, but just using this as a guide. In terms of the femoral popliteal 6 months primary patency of 88%, this is comparable to that of paclitaxel drug-coated balloons. For example, in the Ranger SFA trial, the 6 months primary patency was 87%. For the Lutonix Levant 2 paclitaxel randomized control trial, the 6 months primary patency was 90%. Then, if you look at the below the knee 6 months primary patency of 74%, if you compare that with our own single pacli randomized control trial on paclitaxel balloon, the 6 months primary patency for sirolimus-coated balloon of 74% was highly promising compared to just 42% 6 months primary patency in the paclitaxel drug-coated balloon. When we looked at freedom from major adverse events, this was 86% in the whole group, 89% for femoral popliteal, and 84% for below the knee. In terms of freedom from target lesion revascularization, this was 90% for the whole group, 94% for the femoral popliteal group, and 87% for below the knee group. If we looked at amputation-free survival at 6 months, this was 86% for the whole group, 90% for femoral popliteal, and 83% for below the knee. We did not encounter any immediate complications such as device or technical failure. We also did not encounter any distal embolization or target vessel thrombosis during the operation. We saw a sustained improvement at toe pressures at 6 months for both femoral popliteal and below the knee, and majority of the patients had their wounds healed by 6 months. The conclusions that can be made is that sirolimus offers a potential alternative to paclitaxel drug-coated balloon. The 6 months results were promising, especially so for the below the knee lesions. However, this is only a small study. It is a first-in-human study. It is a pilot study, and the outcomes are only 6 months. So we are following on these patients for the next 12 and up to 24 months to look at the longer-term outcomes for sirolimus-coated balloon in this feasibility first-in-human trial. Next steps are to gather more evidence, and we're looking at level A evidence, which means we are looking at conducting large, multi-center, international, randomized controlled trials. 2 of these trials are currently about to be recruited in terms of recruiting our first patients. These are the future SFA trials looking at femoral popliteal lesions, and secondly, future BTK trials looking at below the knee lesions. We're looking at recruiting about 200 patients in each trial across 3 countries, Singapore, Taiwan, and South Korea. And we are aiming to achieve our recruitment by this time next year. And we hope to have the full 24-month results in about 3 years' time in 2023. Well, the key take-home messages are: peripheral arterial disease is a major problem. Critical limb ischemia is going to be on the rise because of the rising population of diabetic patients. In terms of our angioplasty results, we need to try and improve the durability of our angioplasty results to last as long as possible, at least until the wound heals. And for that to happen, we need to have additional tools in our armamentarium apart from just conventional balloon angioplasty. Paclitaxel drug-coated balloon is a good option. However, as mentioned earlier, 2 problems have transpired. Number 1, safety concerns have been raised. And number 2, it has not been shown to be effective in below the knee. And for these reasons, sirolimus-coated balloon could be a future alternative in terms of an additional tool in our armamentarium to try and improve the durability of our angioplasty results.